دكتورة منال هتتكلم. هي تبع شركة أبوت وهي سبيشالست في الفري ستايل، وهتكلم لنا وبعد كده هنشوف لو في أسئلة.
Good afternoon, مساء الخير. Thank you very much for joining this session. And also I would like to thank the organizers of EFPID for inviting us to present during this event. My name is Elgammal. I'm the Associate Medical Affairs Director for Abbott Diabetes Care, and I have the pleasure to have the opportunity today here to talk about the clinical utility of Freestyle Libre Flash Glucose Monitoring System. So just to take one step back and understand the need for continuous glucose monitoring in diabetes management. As we all agree, monitoring or glucose monitoring specifically in patients with diabetes is very important and is considered a cornerstone to help us better understand the glycemic profile and how the patients are doing in terms of management and treatment. According to the guidelines, such as those by the American Diabetes Association, they recommend that patients who are on insulin should be monitoring at least 6 to 10 times per day. That's when we talk about the conventional methodology of the finger pricks. However, data from the real world shows that patients are testing much less than the recommended guidelines by less than 4 tests per day. And as a matter of fact, patients are less than a quarter of those patients are achieving the A1C targets of less than 7%. And a major reason for why patients are skipping the methodology of blood glucose monitoring is that the convenience and considering it as an invasive procedure that interferes with their life. If we focus more on the pediatric population, unfortunately as well, the data shows a similar pattern. Only 17% of patients below 18 years of old are achieving the targets of 7.5% or below. Again, these patients, as we know, they do struggle with achieving their A1C targets, particularly those teenagers aging from 13 to 17 years of age, because of all the things happening during this age group. So on top of that, they also struggle in self-management and maintaining their targets. We all know as well that the big reason why we fail in understanding the patient's glycemic profile is that they are not using the device. And one of the reasons they don't use those devices is that it doesn't make any sense to them. So when they're doing the finger stick testing or the finger prick testing, they're always struggling with understanding the information that comes from this glucometer. Also, apart from the pain and the inconvenience in doing tests in public, many meters on the market available for those patients are not meeting the accuracy requirements, and even the testing procedure by many of those patients will add to the inaccuracy of the numbers. Moreover, it's not just that the finger testing that adds to the complexity of managing glycemic profile, but also HbA1c. HbA1c is a gold standard and has been considered for a long time as a gold standard to look at the long-term control for those patients. However, being an average and being for a long-term assessment, it does not provide insights into the dynamics of the patient, how they're doing from day to day, and how they're doing throughout the day in terms of the glycemic variability, how does their hypoglycemic profile look like, or even the hyperglycemic exclusions, how they look like. So right now, maybe it's also now close to common knowledge that in addition to the A1C, the time in range is called upon as now the next parameter to be looked at next to the A1C, because it's able to assess how the patients are doing in terms of hypoglycemia, euglycemia, and hyperglycemia, and gives even a deeper context to why the A1C is sometimes not reflective of the reality of the glycemic profile for the patient. So to give an overview on Freestyle Libre Flash Glucose Monitoring System, which has now been available for a few years now in Egypt, and we know that across the globe we have more than 5 million patients or users on flash glucose monitoring on Freestyle Libre systems in general. Freestyle Libre system, just a quick overview, it's a sensor that is applied on the backside of the upper arm and can, for up to 14 days, can provide the patient continuously with glucose readings. The patient will only need to scan over the sensor to get the readings in actual time. It is approved for use in adults and children aged 4 years and above, including pregnant women. Accuracy as per the comparison to the YSI or the Yellow Springs instrument versus the lab, 9.2% for the adult population, and for the pediatric population, a very comparable number of 9.4%. And the patient can apply the sensor and go on with their life. They can swim, they can shower, and the sensor will remain functional. This is how the reader looks. Of course, apart from the reader, the convenience of having the digital health tools, such as the applications or smartphone applications for both Android and iOS systems are available. So what you're seeing right now is the reader, and is considered by some patients that they would like to still continue to use the reader. However, we do encourage both patients and healthcare professionals to utilize the digital health tools for the reasons that I will just mention on the next slide. However, it's important that these utility of the digital health tools will provide better picture and better connectivity between the patient, the caregiver, as well as the healthcare professional. This is how the sensor looks like. Small and sleek. As I mentioned, it is applied to the backside of the upper arm. The only site approved so far for the sensor application is designed to stay on the body for up to 14 days. Requires no fingerprint calibration, meaning that the patient does not require any finger testing to confirm the reading. Now, of course, as we would recommend, in case the patient the symptoms do not match how he or she are feeling versus the readings they are getting on the Freestyle Libre, we would ask the patient to do a confirmatory finger stick. However, outside of these situations, the patient might not need to do any finger stick testing, including no calibration. It is water resistant. The patient can shower, they can bathe, they can swim, just providing they don't go scuba diving and do not immerse the sensor for deeper than 3 meters for more than 30 minutes. 1 meter for more than 30 minutes. And the patient, they can apply by themselves the sensor. It's an easy two-step application. And whether they're using a smartphone app or they are using the reader, the sensor will be able to capture the reading every minute and save every 15 minutes. So going into the details of how the system measures and captures the data, as you can see here, whether it's the reader on the left side or the smartphone application on the right side, similar information are produced upon the scan. We will get the current glucose reading, which is updated every minute, along with the trend arrow, which is again has 5 configurations to indicate the direction or the speed by which the glucose levels are changing, as well as at the bottom is the trend, the 8-hour history, which is generated by the sensor automatically saving every 15 minutes a reading, and then when we do the scan, we will see the 8 hours history. So also just to give you an overview on the platform, maybe we will not be able to have the full time to go into the details of the digital health tools. However, with the experience now we have with healthcare professionals, we know that we have an integrated digital health platform, meaning we have the patients, they have access to the Freestyle Libre link, the smartphone application available for iOS and Android. And then the patient can connect with either a family member through Libre Link app, so that a caregiver or the family member or whoever, even from the healthcare team, they can download the Libre Link app application and connect with their patient, as well as we have the cloud-based system, which is the Libre View, by which the patients are able to connect with their healthcare professionals, and healthcare professionals will have access in real time to the data of their patients, provided that the patients are connected to the internet and the data is from these applications is pulled into the cloud, and then they are able to monitor in real time how their patients are doing. So this is just to give you the flow of how the connectivity for the cloud-based software, which is the Libre view, works. So after the sensor is applied, the patient will activate the sensor and they will start to get the readings. So they can use the smartphone applications. They can also use the reader. And then after they do the scans, and if the app is connected to the internet, or if they connect their reader to the computer with a laptop or desktop, they can connect it basically with a cable. But that's why we always prefer that the patient use the smartphone application so that they don't have to do any connections. And if they are connected to the internet, then the reading from the application will be automatically delivered to Libre view. And then if they have connected with their physician or with their HCP, the HCP is able to review their report via Libre view and give also recommendations which facilitate really better management, and even facilitates for, in many cases, we know that this has supported the setup of virtual clinics and telemedicine. So one of the most important reports that we see in Libre view is the ambulatory glucose profile report, or the E.U.P report, which is now considered the standard of CGM data reporting, has been reinforced by the guidelines over and over, and endorsed by the major associations globally. In that report, we are able to see the time in range targets, as you can see here on the report on the right side of the screen. You see here the time in range color coded with green for time in range, which is defined by the guidelines from 70 to 180 milligrams per deciliter. Then we have the level 1 and level 2 hyperglycemia, and level 1 and level 2 for hypoglycemia. And the recommendations for sitting on those ranges is here on the left side. We also have the average glucose, the GMI, or the glucose management indicator, which has now for quite some time replaced the estimated A1C with an updated calculation based on CGM data. And then we have the glucose variability along with the target for the general population less than 36%. Then we have here the ambulatory glucose profile with the different quartiles here to express how the overall glycemic profile looks for the patient. And at the bottom here, we see the 14-day traces for those patients. So that's from a technical perspective. What about the outcomes of using flash glucose monitoring in real life? And here I'm going to focus on the observational studies rather than on studies that come from a clinical trial setting or more at RCTs, because in real life we know that flash glucose monitoring has really impacted the lives of the patients positively, and has changed the way we are managing patients with diabetes. So we look here at the first study, which is actually more or less, it's an audit. It's a nationwide audit published by the Association of British Clinical Diabetologists, or for short, it's called the ABCD audit, where they looked at data for patients, around 30,000 patients from around 102 centers from all across their patients that were receiving a Freestyle Libre. And over the period of follow-up, the data shows that a clinically significant improvement in A1C, an average of 0.5% from average of 8.3% to 7.8% pre and post the use of the A1C. It's not just the A1C that has improved for those patients, but we also look at the measures for their quality of life, including the diabetes distress has improved, as well as the scores for hypoglycemia awareness has improved as measured by the GOLD score. And moreover, the call out or the hospital admissions, whether due to any acute event, whether hypoglycemia, hyperglycemia, or diabetic ketoacidosis, has also significantly improved. And this would reflect directly on the cost burden on the healthcare system. Another study here, which is a meta-analysis, actually looking at all the data or all the studies that looked at the A1C change in relation to the use of Freestyle Libre. And here we're looking at the meta-analysis of all clinical trials and real-world observational studies, an average of 29 studies with a pool of 1,723 patients. And this meta-analysis showed a consistent reduction in the A1C associated with the use of Freestyle Libre, an average of 0.55%. And more significantly, here what you can see on the right side, that the drop in the A1C occurred within the first 2 months of the use, and after the reduction, this improvement in A1C was sustained over the period of 12 months. This meta-analysis included not just type 1s versus type 2s, it included type 1s, type 2s, as well as pediatric and adult groups, and they all showed the same trend on A1C improvement. The meta-analysis was also expanded to include 75 studies, and this time the pool of patients from 30,478 participants, both type 1 and type 2, to assess the change in, again, the A1C, including pediatric group and the adult group. Again, the reduction in A1C in 3 to 4 months were very much similar to adults with type 1 or with type 2. So we concluded here from this extended meta-analysis that the change in the A1C were observed in type 2s and was comparable to the type 1. So the A1C improvement is not just restricted to those on more intensive insulin therapies or the type 1, but also extends to the type 2 patients. Again, the meta-analysis here would include patients with all different therapies, including the type 2s who are not on intensive insulin therapy. Another real-world observational set of data comes from Saudi Arabia, particularly from the Ministry of Health, where the Ministry of Health was working on a reimbursement project where they provided their pediatric patients with the Freestyle Libre starting from 2018 all the way to 2020, and they continue to do so. However, they decided in 2020 to run an A1C audit for a selected group of patients from across all their 32 centers across the kingdom. And they measured A1C at a baseline of 3, 6, and 9 months. And they ended up by including 1,307 patients with a mean age of 11.1 years, distributed equally between males and females. So the overall A1C over a period of 9 months was reduced significantly from 10.8 to 9.1. And here on the right side, we see the distribution as per the baseline of the A1C. So we see the highest reduction in A1C was amongst those who started with the highest baseline here from 11.7 to 9.5. And there was no significant change for the patients who were already on their targets. Again, from Saudi Arabia, because they are also very keen on seeing improvements in introducing the CGM into their diabetes management. Here, the military hospital in Riyadh, they published a retrospective chart review looking at the association between diabetic ketoacidosis in terms of events and severity with the use of Freestyle Libre over a period of 2 years. Amongst 47 type 1 patients, all they were on multiple daily injections. Again, they were young patients with a mean age of 19.8 years. So here we see the reduction in the DKA events from 2.9 to 0.2 events, as well as not just the number of events, but also the severity. Here they have specified the number of events by severity. So it's not just the number of events, but also whether it's mild, moderate, or severe. The number of events has also been reduced, as well as they scored a reduction in A1C from 7.4, from 9.9 to 7.4 towards 2 years. And more interestingly as well, with this age group, they have reported a higher engagement in terms of management and monitoring. So here we see that the patients were testing at baseline around 2 times using blood glucose monitor. However, by the end of the study, they were doing an average of 8 scans per day. Finally, to highlight more again on the non-glycemic outcomes of the using of Freestyle Libre, this is one of the biggest real-world observational data reported from France. It's called the RELIEF study. Here we see it on the left side, where they looked at around 74,000 patients, older patients, in their system receiving Freestyle Libre as per their reimbursement criteria. And whether it's type 1 or type 2, there was a significant reduction in all cause hospitalizations, whether it's DKA, coma, or any acute event. They were, or general admission, they were significantly reduced in this population. And on the right side here, we see again another real-world observational data from the US coming this time, where they looked at a period of 6 months for patients, type 2 patients who were using Freestyle Libre 6 months pre and post. And they also measured the reduction in all-cause inpatient hospitalization. And as you can see here, the improvement was around the hazard ratio by around 32% here between the pre-acquisition and the post-acquisition. So in summary, Freestyle Libre flash glucose monitoring is a continuous glucose monitoring that requires no finger stick calibration required. It measures, the sensor measures automatically every minute and stores every 15 minutes. The patient can scan using the reader or the application as much as they want. More importantly, they can now connect with their caregivers via the caregiver app Libre Link Up, or with their healthcare professional via the cloud-based software, which is the Libre View. The accuracy is unsurpassed for adults and in children, and shows improved glycemic outcomes in clinical trial settings as well as in real-world settings. And just to close, Freestyle Libre now, with a base of 5 million users across the globe, has received reimbursement, whether it's type 1 pediatrics and beyond, in more than 43 countries. And we hope that this technology continues to change the face of diabetes management. So that's it from my end. Thank you very much. And now we may receive any questions. Thank you.
Manal, I would like to ask you one question. What's new? What are going to introduce to our country later?
اولا مساء الخير دكتور منى، مساء الخير دكتور عبير، ومساء الخير ل all the audience. Thank you very much for the opportunity to be present today at ASPED. What's new is ان شاء الله نحن we're working to have Freestyle Libre 2 with an update. Maybe you've heard about it. It's launched already in the UK, where we have transferred the Libre 2 into a real-time CGM. So there is an update to the application where it allows Freestyle Libre 2 to now automatically communicate with the application. So hopefully, once we have Freestyle Libre 2 in Egypt, as soon as possible, we're working to have this. We will have this with along with the update.
Thank you, Dr. Manal, for the very nice comprehensive lecture. Hope to see you here among us actually next time.
إن شاء الله. It was the plan إن شاء الله. يعني هو كان المخطط بس unfortunately didn't work.
The problem now in a large population country like our country, a big number of patients with type 1 diabetes, limited resources, low income. What can you offer to support these patients with Freestyle Libre? At least Libre 1 until we have Libre 2.
Thank you very much, Dr. Abir, for your question. What we're trying to, يعني نحن كأبوت, we have يعني social and ethical responsibility towards all our patients using Freestyle Libre. So we're really trying to work closely مع all the decision makers and the associations within يعني Egypt to be able to offer the patients يعني easy access to the device. But right now, you know, there are certain challenges that, again, we're trying to continuously try to work around. But I can share, for example, an experience from a country like Turkey. They're also having similar challenges in providing the device to their patients. What they did is they worked through the Ministry of Family, where the Ministry of Family now is providing all their pediatric populations and patients with Freestyle Libre. This was a governmental / presidential initiative, and we were able as Abbott to collaborate with the Ministry of Family rather than the Ministry of Health. So wherever we have the opportunity to collaborate and support, we are trying to do this relentlessly, to be honest. فإن شاء الله يعني كمان جهودنا بإيجيبت with all the decision makers يعني be fruitful, and we will be able to provide access to the patients with Freestyle Libre and the next updates to the technology as well.
Inshallah, as soon as possible بإذن الله.
Inshallah.
Thank you very much. See you very soon.
إن شاء الله يا دكتور منى. شكرا لحضرتك. شكرا دكتور عبير. شكرا.
Thank you.
الجلسة الثانية بقى على طول كيس ستادي، فدي هتصحصحكم شوية. فدلوقتي الدكتورة منى سماحي والدكتورة شيماء الرفاعي وشيماء السيد والدكتورة رشا طريف يتفضلوا.